In this segment, we will provide updates on several line-of-duty death resources and profile the one multiple line-of-duty death that occurred since our last symposium, noting the lessons learned and the lessons that should be heeded by all of us. In 1998, Congress recognized the need to further address the continuing national problem of job-related firefighter deaths and funded the National Institute for Occupational Safety and Health to implement a firefighter safety initiative. The IFF worked with the Clinton administration to create the NIOSH Firefighter Fatality Investigation and Prevention Program, a program that we continue to support. To tell us more, I would like to introduce Don Castillo. Don is the Director of Division of Safety Research at NIOSH. This division serves as the focal point for traumatic occupational injury research and prevention programs at NIOSH. Please welcome Don Castillo.
Well, thank you to the previous presenters for their outstanding presentations, for them sharing their expertise, their experiences, and their lessons learned. It's an honor for me to be asked to present and to represent NIOSH. Thank you. So this is what I will cover in the next 10 minutes. I will provide background on the NIOSH Fatality Investigation Program, share with you some recent products since the last symposium, provide examples of how investigation findings are used to improve firefighter safety and health, and share information about a couple products that are in the works. So first, some background. For those who may be unfamiliar with NIOSH, we are the federal agency with responsibility to conduct research to make recommendations to improve worker safety and health. Our vision is safer, healthier workers. Our mission is to develop new knowledge and to transfer that knowledge into practice. As Pat noted, the Firefighter Fatality Investigation Program began in 1998 with considerable support from the IAFF. The purpose of the program is to conduct independent, objective investigations of firefighter deaths so that fire departments across the country can learn from them. We do not place blame. Instead, we look for contributory factors that fire departments, again, across the country can use to avoid similar incidents. Each investigation results in a narrative report that describes the incident and makes recommendations for preventing similar incidents. The investigations are voluntary and they're conducted upon request. We will conduct an investigation only if we have full cooperation of the fire department and firefighters. Sometimes we need to decline requests if we have a very heavy investigation backlog. This slide shows the teams that contribute to the program. They include a team that investigates traumatic injury deaths, Dr. Wendy Deck, who investigates medical deaths, and a small team that evaluates the potential contributions of SCBA failures to firefighter fatalities. They have a range of training and experiences, including several with firefighting experience. Some of you may note that a few staff who have been with the program from its inception are not listed. After years of valuable service with the program, Tim Mariner, Tommy Baldwin, and Paul Moore retired. We anticipate filling a couple of positions in the traumatic injury investigation team. If any of you are interested in working with us, I encourage you to reach out so that we can let you know when those vacancy announcements are made. Matt Boyer, Karis Klein, and Jay Tarley are all participating in the symposium. I encourage you to follow up with them if you've got questions or would like to discuss the program. Based on data from the U.S. Fire Administration, since the first full year of the program in 1999, there have been more than 1,900 line-of-duty deaths of firefighters, excluding those associated with the World Trade Center attacks. We do not have the resources to conduct investigations of every firefighter fatality, and thus we have identified priorities for investigation. Current priorities include events involving multiple fatalities, deaths in structure fires, and sudden cardiac death during fitness and emergency response training. We have completed investigations for 751 deaths, or 39% of firefighter fatalities since the program began. This is what a report looks like. It includes an executive summary, pictures and graphics, and most importantly, recommendations for preventing future deaths. This is a screenshot of the program webpage, and the address is at the bottom of the slide. The website includes a list of pending reports and links to every fatality investigation report and publication. This website is among the most viewed on the NIOSH website, with more than 400,000 views each year. This figure, which is available on our website, shows the number of firefighter fatality investigations we've conducted by state. Investigations have been conducted in every state. The shading darkens with increasing numbers of investigations, and states in deep blue are those in which we have conducted more than 15 investigations. If you go to our website and click on a specific site, the website will generate a list of all investigations conducted within that state. This slide shows a screenshot for an interactive website in which you can generate maps, charts, or case listings for variables of interest to you. The map on the slide shows the geographic locations of firefighter deaths in 2019 as of early July, based on U.S. Fire Administration data. And it indicates that 3 investigations are currently underway in yellow. The web address is at the bottom of the slide if you'd like to check this out. In addition to producing reports for each investigation, we also summarize findings across multiple investigations, and the following slides show publications since the last symposium. NIOSH staff grouped recommendations from fatality investigations into major categories, identified the top 10 types of recommendations for the period of 2006 to 2014, and compared these findings from an earlier period, and this was published in a scholarly journal. These were the top 10 recommendations: medical screening, fitness and wellness programs, training and medical clearance, which had not been identified among the leading recommendations in the previous analysis, incident command, strategy and tactics, communications, personal protective equipment, and staffing. This is a picture of a workplace solution that summarized findings from multiple investigations of firefighters who died while fighting basement or other below-grade fires. This is a 5-page document with a case study, graphics, recommendations for controlling risks, and references. Shown on this slide are 2 fact sheets on rhabdo, which can be caused by exertion and becoming overheated, and it can be fatal if it's not recognized and treated early. One fact sheet is targeted to structure firefighters, the other to healthcare providers. These fact sheets and similar fact sheets targeted to wildland firefighting are available at the link on the bottom of the slide. So NIOSH is aware of a variety of ways in which our fatality investigation reports and publications are used to improve firefighter safety and health. One of the ways is by influencing NFPA standards. NIOSH participates on multiple NFPA committees to help ensure that the committees are aware of relevant investigation findings and research. Shown on this slide is an example of how investigation findings influenced an NFPA standard revision since the last symposium. The 2019 edition of NFPA 1981 on SCBA includes enhanced testing to ensure that the second stage regulator will not pull out of the facepiece lens. The revised standard also includes a requirement for 2 distinct actions by the firefighter when removing the regulator from the facepiece, such as a pull or a push to release the latch followed by rotating the regulator. These improved testing methods and designs will help ensure that firefighters do not encounter a deadly situation where their SCBA is inadvertently compromised. The revised standard also includes requirements for enhanced pneumatic data logging. Such logs have proven to be valuable in NIOSH investigations, and we presume that they will also be useful in air management training for firefighters. The fatality investigation teams have learned of numerous examples of investigation reports being used in education and training. These include fire departments and training instructors using individual reports as training tools. Examples include fire departments training on reports from similar-sized jurisdictions, and when fire departments recognize the potential for a similar event in their area. Since the last symposium, the IAFF has used fatality reports to update the IAFF Fireground Survival Manual. Fire Rescue TV, which is a cable television network that is broadcast to more than 300 fire departments in the United States, uses the fatality investigation reports and training videos, including videos produced around individual reports. FireFightersCloseCall.com creates posters for individual reports, such as that shown on the slide, which can be printed and posted in fire departments. And these posters summarize the fatal event and identify contributory factors. And there are numerous examples of firefighters training to become executive fire officers who use the fatality investigations in research projects. This includes training at the National Fire Academy and at universities. NIOSH staff are also aware of the investigation reports being used by fire departments to improve standard operating procedures and guidelines. Examples since the last symposium include individual fire departments reviewing reports to revise their procedures and guidelines pertaining to personnel accountability, training, SCBA maintenance, and staffing. Investigation staff helped IAFF identify reports addressing minimum staffing, and by request, NIOSH provided reports on radio connectivity issues in older buildings to a congressional staffer. We haven't seen pending legislation, but we were happy to be able to provide relevant information. We are working on a couple products that consolidate findings from investigation reports into concise guidance. The fact sheet and poster displayed on the slide address row house firefighting tactics, and they're slated to be published this fall. Based on the response that we received when testing these materials, we're also in the process of producing similar products on strip mall fires. I would like to wrap up by emphasizing that my presentation includes highlights from the Fatality Investigation Program, and it's not comprehensive. If you'd like to learn more about the program, there is a workshop today at 1:30. I also encourage you to stop by our booth, follow up with staff, and check out our web pages. I'd also like to give a plug for NIOSH colleagues who will be participating in the 1:30 p.m. Cancer Research Workshop later today. And finally, I'd like to express on behalf of myself and my colleagues at NIOSH sincere appreciation for the opportunity to work with you. We're very appreciative of our partnership with the IAFF, and we look forward to continuing to work together to improve firefighter safety and health. Oh, thank you.